So here we have Dr. Hanna and Dr. Eva working on probiotic research.
Yes, I'm Hanna Sijabat from the University of Queensland, Centre for Clinical Research, Brisbane, Australia.
And I am Dr. Eva Gran Håkansson, CEO of SM Probiotics, Umeå, Sweden, and I'm also connected to Umeå University in Sweden.
So Hanna, what is the purpose of your visit here in Sweden?
We have been characterizing probiotic strains from commensals, and I would like to use our probiotic strains isolated from Australian population in the clinical trials. So we'll have evidence of this goodness of the probiotics to treat infections. And Eva is one of the experts in this field.
And Eva, what is your experience in this probiotic clinical research?
Well, I have done this research for more than 30 years, starting with the upper respiratory tract and looking for the normal flora that could help children with recurrent infections. So we isolated the Streptococcus oralis 89A, and it was a commensal that could be used for not having recurrent infection in both otitis media and streptococcal tonsillitis.
Hanna, what probiotic research do you do in Australia?
So we are screening probiotics from upper respiratory tract, and we culture or grow both the bad and the good bugs, and we try to compete or perform bacterial interference experiment between the good and the bad bugs, and we screen for the good one that has the killing activity against the pathogens or the bad bugs. And then we are going to use this for the clinical trial.
Yes, and we have used a lot of different probiotic strains, both for upper respiratory tract and also for intestinal use. And we have had at least 1,000 patients, both children and adults, in the studies. So we have done a lot of clinical studies, yes.
Yeah, and I'm most interested in the use of Streptococcus oralis 89A and then the Lactobacillus rhamnosus 21 or LB21. And we have a publication together, joint publication on the genome sequence of the oralis 89A. So our expertise is actually on the genome sequencing analysis of these probiotic strains, and we have a collaborative work that we will have joint publications in this space. But for the purpose of my visit to Umeå is to learn from Eva about the applications of the probiotics in the clinical trials.
Eva, what clinical trials have you done?
Well, most in children we have clinical trials in streptococcal tonsillitis, giving back the normal flora, so we will not have any new infections. And we have also done intestinal studies, mostly in adults, for constipation, for example, gluten intolerance, and antibiotic-associated diarrhea, for example. So really a lot of clinical trials during this time.
Hanna, are you going to use this Lactobacillus bacteria?
Yes, of course. We have isolated a good bunch of Lactobacillus rhamnosus especially, and then Casei, Acidophilus, and Gasseri, and they have excellent activities against pathogens causing chronic rhinosinusitis and otitis media, and as well as the pathogens associated with antibiotic treatments, for example, Clostridium difficile. So we are going to use these Lactobacillus strains for 3 different clinical trials for CRS or chronic rhinosinusitis patients, otitis media, and then for oral administration for gut disturbance.
Eva, do you use Lactobacillus bacteria in any products today?
Yeah, today you can find Lactococcus lactis L1A and Lactobacillus rhamnosus LB21 in milk products in Sweden under the brand of Verum. And it's both fermented milk and yogurt, and it's the biggest milk-based probiotic product in Sweden today. So, and also Streptococcus oralis has been in a product used for upper respiratory tract infections.
And we have actually tested Lactobacillus rhamnosus against Australian pathogens as well, the LB21.
Yeah.
So I think our probiotics are, some of them are equally as good as the LB21.
Hanna, what is your current stage on your probiotic research?
So we have completed the phenotypic testing where we compete between the good and the bad bugs, and then we are currently analyzing the whole genome sequence data, and we are also performing the cell culture model to see the probiotic action in protecting the gut mucosal membrane, and we are planning to establish the cell culture model for upper respiratory tract as well, and we will actually prepare the next batch of whole genome sequencing samples. So that's the current stage of our probiotic research at the University of Queensland, Australia. And I always like to have Eva to provide us advice in terms of the usage of these strains in the clinical trials. Okay, so I think that's our chat for today, and thank you for watching. Yeah.
Tack så mycket för att ni tittade.
And see you next time. Bye bye.
Bye bye.